Bismillahirrahmanirrahim. Assalamu alaikum everybody. Today we're going to be talking about the posterior compartment, the muscles of the posterior compartment of the leg. So let's first get an overview of what the posterior compartment is. Now if this is showing you a cross section of the leg, so this is the tibia and this is the fibula. Now between these two we all know that there is the interosseous membrane, and then you have the various intermuscular septa forming the anterior, lateral and the posterior compartments. So posterior to the interosseous membrane you have the posterior compartment, and the posterior compartment of the leg is further subdivided into two subcompartments by the presence of a transverse intermuscular septum, right? So this whole thing is the posterior compartment of the leg. It is of course the largest of the three compartments, and this posterior compartment is then further divided into a deep subcompartment and a superficial subcompartment by the presence of this transverse intermuscular septum. Now when we talk about these two subcompartments, the superficial subcompartment is the least confined of the two, because of course you only have the deep fascia of the leg here and then the transverse intermuscular septum here. But compared to that, when you talk about the deep subcompartment, which is of course the deeper of the two, and this is bounded by the interosseous membrane, the two bones and the transverse intermuscular septum. Now the deep subcompartment is quite tightly confined, and most of the blood vessels and nerves which supply the posterior compartment, as well as which pass through this posterior compartment and then into the foot and supply the sole of the foot, they also pass through this deep subcompartment. And if compartment syndrome occurs due to swelling of muscle or anything, this can have serious consequences. For example, tissue necrosis can occur, and paralysis of the nerve, which would be the tibial nerve in this case. So here as well you can see the various compartments, cross section of the leg, and this is the tibia, the fibula, this would be the anterior compartment, the lateral compartment, and all of this is the posterior compartment. Now here you can see the transverse intermuscular septum, and this transverse intermuscular septum is dividing the posterior compartment into a superficial subcompartment and a deep subcompartment. This shows the various muscles in the anterior compartment, lateral compartment, and this all is the posterior compartment. Out of these two subcompartments, the more confined deeper compartment is the smaller one, and the superficial subcompartment is the much larger of the two. The muscles of the superficial subcompartment are the Gastrocnemius, the Soleus and the Plantaris. And when it comes to the deep subcompartment, you have the tibialis posterior, the flexor digitorum longus muscle, you have the flexor hallucis longus muscle, and the popliteus muscle. This transverse intermuscular septum, inferiorly or distally, it ends as the flexor retinaculum. We'll talk about the retinaculum in detail in a subsequent lecture, but for now it's important to know that this transverse intermuscular septum inferiorly ends as the flexor retinaculum. When we talk about the muscles of the posterior compartment, these muscles are primarily responsible for bringing about plantar flexion, inversion of the foot, as well as flexion of the toes. Right, so what is plantar flexion? Plantar flexion is this movement shown here when you bring about the dorsal surface of the foot away from the anterior surface of the leg, right? So the angle between this anterior surface of the leg and the dorsum of the foot becomes greater. This would mean plantar flexion. And similarly, the opposite of that is dorsiflexion, when the angle between the dorsum of the foot and the anterior surface of the leg becomes smaller, right? So that would be something like this. So if this is the foot, if it moves like that, that would be dorsiflexion. And if the foot moves away from the anterior surface of the leg like that, this is plantar flexion. So the muscles of the posterior compartment of the leg are primarily responsible for plantar flexion. In addition to that, they also bring about inversion of the foot. Now, inversion of the foot is when the sole of the foot faces the median plane, right? So the sole of the foot is directed towards the median plane. So that would mean that the lateral margin of the foot is on the ground and the medial margin of the foot is raised away from the ground. So that would be inversion. The third thing that this group of muscles, the posterior group of muscles of the leg, that it brings about is flexion of the toes. And flexion of the toes would be when these toes are directed downwards. Okay. So this movement of the toes would be flexion, and when these toes move towards the dorsum of the foot, that would be extension of the toes. So flexion of the toes, inversion of the foot, and plantar flexion at the ankle joint are the three movements brought about by the muscles of the posterior compartment of the leg. Now, comparing plantar flexion with dorsiflexion, plantar flexion is 4 times stronger than dorsiflexion, because when we talk about plantar flexion, the plantar flexion is when the ball of the foot is supposed to move downwards away from the anterior surface of the leg, right? But if the foot is on the ground, what it will do, plantar flexion would do is that since the toes and the ball of the foot is already on the ground, so the natural action then would be to raise the heel off of the ground, right? So which is shown in this diagram here. So this is plantar flexion, and when the body brings about plantar flexion, what it is doing is that it is actually elevating the weight of the entire body off of the ground. So it's acting against gravity, and it is raising the whole weight of the body off of the floor, off of the ground. So these muscles need to be really strong, and that is why the muscles of the posterior compartment, especially those which are responsible for plantar flexion, which are the muscles of the superficial subgroup or subcompartment, the gastrocnemius, the soleus. Plantaris is also a part of this group, but it is not much of a factor in producing plantar flexion. So mainly the gastrocnemius and the soleus are responsible for bringing about plantar flexion. And what plantar flexion does is, when you're walking, you're running, it is elevating the weight of your entire body off the ground, and therefore these muscles need to be really strong. And hence the gastrocnemius and the soleus are big and strong muscles. So first we're going to talk about the superficial subcompartment. Now this subcompartment comprises of the gastrocnemius, the soleus, and the plantaris muscle. Now the gastrocnemius, the two heads of the gastrocnemius, along with the soleus together are known as the Triceps Surae, right? And they share a common tendon which is known as the tendocalcaneus. So this here is showing you the two heads of the gastrocnemius, and this is the common tendon which is known as the calcaneal tendon, the Eclease tendon, the tendocalcaneus. They're all the same. They're all the names for the calcaneal tendon, and they have a common insertion into the calcaneus here. Right, so let's talk about the gastrocnemius first. We have talked about the origin of the gastrocnemius before when we're doing the femur. The lateral head originates from the lateral aspect of the lateral condyle of the femur, and the medial head originates from the popliteal surface of the femur superior to the medial condyle. So here you can see the origin of the medial head of the gastrocnemius and the lateral head of the gastrocnemius, right? So these are the two heads of the gastrocnemius, and the insertion, of course, is through the calcaneal tendon, the common calcaneal tendon on the posterior surface of the calcaneus. Now the calcaneus is a bone of the foot, and on the posterior surface of the calcaneum there is the insertion of the calcaneal tendon. The gastrocnemius is the most superficial of all the muscles of the posterior compartment. It also spans two joints, right? So of course it originates from the femur, the lower end of the femur, so it spans the knee joint and brings about flexion at the knee joint here, and in addition to that it also spans the ankle joint and brings about plantar flexion at the ankle joint, right? The medial head is larger and it extends slightly more distally. The two heads of the gastrocnemius also form the inferior boundaries of the popliteal fossa. So the action of the gastrocnemius is that it brings about flexion at the knee joint and plantar flexion at the ankle joint. But it's important to remember that it cannot bring about both of these actions at the same time, right? So it cannot plantar flex when the knee is fully flexed, right? So for a full, complete, powerful plantar flexion to take place at the ankle joint, the knee has to be fully extended, right? So either one of the actions can be performed at one time completely, right? So if the knee is slightly flexed, then the plantar flexion that would be brought about would not be as strong, or as the degree would not be as much. And similarly, if the knee is completely flexed, then gastrocnemius cannot bring about plantar flexion at the ankle joint. Another thing to remember when it comes to the gastrocnemius is that its fibers are mostly the white fast twitch variety. So gastrocnemius is the muscle that you need when you're sprinting, when you're running, when you're jumping, right? So during all of these actions, gastrocnemius is the muscle that is most active. But as opposed to that, the soleus muscle, which is of course the other remaining part of the triceps surae, is responsible for strolling, right? When you're casually walking at a low pace, or in addition to that, when you're standing up for long periods of time, it is the soleus which is mostly active. Gastrocnemius is employed. It does act during the long standing as well, but it is used only intermittently and not all the time, whereas the soleus is the workhorse of plantar flexion. So when you're standing for long periods of time, it is the soleus which is active throughout. When it comes to the nerve supply of the gastrocnemius, it is supplied by the tibial nerve. All the muscles of the posterior compartment of the leg are in fact supplied by the tibial nerve. Now talking about the soleus muscle. Now the soleus muscle, it is the workhorse of plantar flexion, like we just talked about. It's a large muscle, but when compared to the gastrocnemius, it is much more flattened as compared to the gastrocnemius. Now the origin of the soleus muscle is in the form of an inverted U, right? So it originates from the tibia as well as from the fibula, right? But this origin is in the form of an inverted U, like that. And in the middle, in between these two bones, the tibia and the fibula, here there is a tendinous arch, right? So there's a gap in the form of a tendinous arch, and this is known as the tendinous arch of soleus. And what it does is that it allows the passage of the popliteal artery as well as the tibial nerve from the popliteal fossa and into the posterior compartment of the leg. So the origin of the soleus is from the posterior aspect of the head of the fibula, and then all the way down here, the posterior surface of the fibula, the upper part of the posterior surface of the fibula. In addition to that, from the tibia, the soleal line gives origin to the soleus muscle. So as you can see, it is in the form of an inverted U with a tendinous arch of the soleus in between these two. And again, the insertion for the soleus would of course be the posterior surface of the calcaneus here. So this is the common insertion of the tibia of the gastrocnemius as well as the soleus, right? And via the Eclease tendon or the tendocalcaneus into the posterior aspect of the calcaneus, the common insertion. Now, although the triceps surae have a common insertion, they can and they often do act independently of each other, right? And when it comes to the soleus, it acts alone to bring about plantar flexion when the knee is fully flexed. As we just talked about the action of the gastrocnemius, that it cannot perform plantar flexion when the knee is flexed. So when the knee is flexed, the plantar flexion, which is brought about at the ankle joint, is by the action of the soleus muscle. The soleus is comprised of red, slow twitch type, fatigue resistant fibers. So it is used in, so it is capable of sustained prolonged contraction, and it brings about strong but slow plantar flexion. So it is not used in running or jumping, but when you're strolling and for extended periods of time when you're standing. It is the soleus which is doing the job. Okay, so another important thing to remember when we're talking about the action of the soleus is that when you're standing up, the line of gravity, it lies anterior to the bony axis of the leg. So this is, I've tried to make a tibia here. So this blue one is the tibia, and this is the bony axis of the leg, right? So this arrow indicates the bony axis of the leg, but the line of gravity actually lies anterior. So you're looking at the tibia from the side, right? So this is anterior and this is posterior. Okay, so this is the line of long axis, the bony axis of the leg, and this line indicates the line of gravity. So naturally there's a tendency for the body to fall forwards because of the line of gravity lying anterior to the long axis of the bony long axis of the leg. But this action of this line of gravity is countered by the action of the soleus muscle. So the soleus muscle, which is attached to the posterior aspects of both the tibia and the fibula, what it does is that there is a sustained contraction of the muscles of the soleus, and they keep pushing or rather pulling the body backwards, and they prevent the body from falling forwards. So when you're standing up for long periods of time, your legs get tired because the soleus is continuously acting on the body to keep it from falling anteriorly. It may employ the gastrocnemius intermittently from time to time, but primarily it is the soleus muscle which is responsible for breaking or for not letting the body fall forwards. Now when it comes to the nerve supply, again the soleus is supplied by the tibial nerve. So when it comes to the action of the soleus, the plantar flexion that it carries out is independent of the position of the knee, because the soleus muscle is only spanning one joint, which is the ankle joint. So whatever the position of the knee is does not make any difference to the action of the soleus as opposed to the gastrocnemius. So whether the knee is extended or flexed, the soleus can bring about plantar flexion at the ankle joint. So the gastrocnemius and the soleus form the triceps surae, and although the other muscles of the posterior compartment do bring about some degree of plantar flexion at the ankle joint. 93% of the force of plantar flexion at the ankle joint is actually generated by these muscles, the gastrocnemius and the soleus. So here you can see the soleus muscle. This here is the soleus, and the gastrocnemius has been cut off. So these are the two heads of the gastrocnemius, and inferiorly or distally they form a flattened aponeurosis, right? And this then receives the fibers of the soleus muscle on its anterior aspect, and together they then become more rounded, and as they move distally towards the foot, they become more and more thick and more rounded. And in addition to that, they also there's also a movement of spiraling, right? So there's also a spiral turn of about 90 degrees of this of these fibers of the tendocalcaneus, and it is believed that this spiraling of the tendon helps in the function of shock absorption by this tendon. Now, the calcaneal tendon, also known as the Eclease tendon, is the most powerful tendon in the body. It is about 15 centimeters in length, and distally it becomes more and more rounded and more thick, right? Again, as I just said, it rotates 90 degrees before being inserted into the calcaneus, and this leads it to absorb shocks, right? And for example, when you're jumping and running, so it leads to a much smoother movement. So the third muscle in the posterior superficial subcompartment of the posterior compartment of the leg is the plantaris. Now, the plantaris is absent in 5 to 10% of the people. It's a small muscle. It has a very short belly and a very long tendon. So you can see here, this here is the plantaris, right? And this is the belly of the muscle, and then it has a long tendon. And eventually, this tendon also fuses in the Eclease tendon of the tendocalcaneus and is inserted into the calcaneum. The plantaris muscle does aid gastrocnemius in plantar flexion, but the plantar flexion that it does bring about is quite negligible. So it is thought to be a vestigial muscle, but also it is considered that it is an organ of proprioception. Now, because its action for plantar flexion is negligible, the plantar flexion that it does bring about is not of any significant value, this tendon can be used for grafting. For example, if you're doing reconstructive surgery of the hand and you need grafts of tendons, this plantaris muscle can be used for grafting. Because of the long tendon that the plantaris has, it is often known as the freshman's nerve. Freshmen, of course, are the new students that have just joined the college, the medical college, and while dissection, they can easily confuse this tendon with a nerve, and therefore this is also called as the freshman's nerve, the plantaris muscle.